Hey everybody, and welcome back to another Java with Janine. And today we're going to talk about Medicare and what it doesn't cover. In fact, I'm going to list 7 things that Medicare does not cover. And I know this is an exciting topic. I know some of you are already on Medicare. So anyway, we'll try to make it a little bit interesting for everybody who's starting to think about these things, because you need to, if you're getting close to that point, you need to start doing a little research right now. Medicare A is hospitalization. It covers hospital stay, stays with skilled care, surgery, and hospice, among other things. It's generally hospital related. Medicare B is going to cover your doctor's appointments, doctor's visits, outpatient care, and some preventive care. You're going to need both. But what it does not cover is prescription drugs. That's Part D. No matter how you arrange it, you can get some advantage care that's including with drugs or including the drug coverage, but Part D is the drug coverage. Now, the important thing to remember there is if you are on a specific drug, make sure it's on the formulary for the plan that you choose, because I've heard some horror stories where folks are taking very expensive drugs and it's not on the formulary. So that's going to come out of pocket. Okay, the other thing it does not cover, and I did cover this in classes years ago, but just to remind everyone, Medicare will not cover long-term care. It covers the hospital stay for a while, okay, but it does not cover long-term care. So when you can no longer, when you get released from the hospital and you're at home and you can't do 2 of the 6 activities of daily living, you're essentially legally on long-term care of some sort. So the median long-term care is $105,000. That was in 2020. And obviously that depends on where you are and the type of care you're going to need. But first and foremost, long-term care is a conversation about what you want to have happen should you end up in long-term care. Who is going to be your medical advocate? Now, in your medical directives that we talk about with wills and estate documents, that's the person that you've given directive to basically direct your care. The medical directive says what you want to have happen. The medical directive authority, or the power of attorney, essentially medical power of attorney, tells this person, this tells the hospital, this is the person I want to have make these decisions, and that's the person who's going to pull the plug. So if you need to renew these things on a fairly regular basis every couple of years, because things do change. But it's really important to know and to put that in place. So again, long-term care is a conversation first, and then starting to look at what you want to have happen should you hit your 80s. Most people do want to stay in their homes. That's my parents wanted, my mother wants to die in that home. So I keep telling her, if you piss me off, you're going to die sooner. So joke in the family. But it's a very important conversation to have, because hopefully your family or your best friends or somebody's going to be there to take care of you or direct the care. That's a really important point. Okay, so Medicare does not cover deductibles or copays. And your Part A deductible is $1,484 for 2021. And then it's going to be $371 a day for the first 60 to 90 days. And then it's going to be $742 after that a day. So you need to kind of look at those numbers and see how that would affect you if you ended up in care for that long. Part B, 20% of the costs after the first $203 are deductible, and you'll probably need Medigap coverage because it's not going to cover beyond that. It does not cover dental care, so you'll have to buy a dental policy. It does not cover vision care. Now, Medicare will cover little bits of things, but for the most part, preventive medicine, preventive care, it's not going to cover that. It's not going to cover glasses. So if you had an HSA before you retired, you can use that money certainly for these costs. Otherwise, you're just paying out of pocket unless you get a separate policy. It does not cover hearing aids. I think my dad is now on his 3rd pair, and those can be a whopping $4,000, $5,000, $6,000, $7,000 they're getting better. in terms of quality, but you know, they can be uncomfortable. So a lot of elderly won't wear them because they're uncomfortable. So you just need to look at that. I mean, one of my brothers, my youngest brother, actually has some hearing loss because he was an artillery officer. And so even though they weren't earplugs, he's in his 50s and he's already got some hearing loss. So he's a candidate for hearing aids at some point in time. It doesn't cover care. Now, this is really important because as we're coming out of all this COVID stuff and people start to travel, if you're on Medicare, you need to be aware that it does not cover care when you travel abroad. In fact, Medigap plans, it's really important, C through G, M and N will cover 80% of any emergency care that you're going to need when you travel abroad with a lifetime limit of $50,000. So if you're going to be traveling abroad this year or next year, plan it, and you're on Medicare. When you go to choose your Medicare, Plan B especially, you know, talk with somebody about that because you're going to want some plan that's going to cover that. Just in case. I actually, a family friend of my parents, when they had just gotten to Rome. This was probably a good 15 years ago. They had just gotten to Rome and he had a heart attack. So he spent his time in Rome in the hospital while they were touring around. So it happens. He was relatively young. He was probably in his late 50s, early 60s. So it's just, it can happen. You need to prepare for it. But anyway, so there are a lot of things it doesn't cover. If you are getting close to having to choose Medicare coverage, I highly recommend MedicareBackOffice.com. They've been very, very helpful for a lot of clients that I've sent there. They don't have, you know, some particular policy to push. They will help you sort out what you want in the plan and based on the state that you're in. And they've been very, very good and very responsive. So again, it's MedicareBackOffice.com. Tell them Janine sent you because I'm trying to keep track of who goes there and make sure that I get some feedback. So anyway, I hope this helps. It's a little bit long, but I think it's really important as people start to get back to activities and needing some additional information to make sure that you're covered sufficiently. So again, have a great day and I'll see you next time.